Sorry about that. D, air conditioning can decrease the humidity in a room, making it easier for clients to breathe. And so we wouldn't want to avoid an air conditioned room with someone who has COPD. It would actually help them. So avoiding it would not be the correct answer. Next question. An OT is fabricating a resting hand orthotic device for an individual with extremely fragile skin. Which areas will the OT have to inspect most carefully for signs of skin breakdown? Okay. A, metacarpal heads, pisiform and trapezium. B, volar PIP joints, medial fifth digit and thumb MP joints. C, ulnar styloid, distal head of radius, and thumb CMC joint. So, just from my understanding of like bony premises and knowing that they're more at risk for pressure sores or pressure injuries, I would go with C. The ulnar styloid, distal head of the radius, and thumb CMC joint are bony premises and are most likely to be at risk for an injury. Both A and B are also vulnerable areas. However, they are not as prone to those pressure injuries as like the bony prominences are. Next question. Which are the most appropriate interventions for the OT to plan in treating a person following a total knee replacement? A, using range of motion and strengthening activities for the upper extremities. B, providing range of motion and strengthening activities for the lower extremities. C, providing ADL training in the use of adaptive techniques for lower extremity dressing and transfers. D, observation and assessment of homemaking activities. So this for me is a no-brainer. C, providing ADL training in the use of adaptive equipping techniques for lower extremity dressing and transfers would be the most appropriate for this question. A is not appropriate as the upper extremity was not affected, although it can be useful to operate adaptive devices. It's not the most important. B, strengthening muscles and increasing range of motion in the lower extremities is important. However, if it's regarding occupational therapy, it is important to consider the client's occupation, right? What they're trying to get better at, what's important to them. And D, observation and assessment of homemaking activities likely occur closer to the client returning to their prior returning to a prior level of function and returning home, not right now in this moment. Next question. The administrator of a long-term care facility asked the OT who works there to help develop a job description so they may hire a second OT. What would an OT job description most likely contain? A, previously established mutual goals, quality of patient care, achievement of predicted outcomes, and evidence of relationship building. B, a summary